And welcome everybody to another edition of RegWatch on GFN.tv. Around the world, advocates for safer nicotine products make a simple request of policymakers: apply reason and common sense to decisions impacting access and choice to these potentially life-saving products. But in a growing number of jurisdictions, these principles of sound decision-making are treated with scorn and contempt. Joining us today is someone who knows a great deal about promoting reason and common sense, Australian politician Fiona Patten, leader of the Reason Party and MP for the Northern Metropolitan region in the Victorian Legislative Council. Fiona, thanks for coming on the show.
Thanks for having me, Brent.
Your path to Parliament is not a typical one. Tell us, how did you get your start in politics and why?
I first got involved in politics in a very peripheral way during the HIV and AIDS epidemic. So I was volunteering on a needle exchange program. It was a mobile bus, and I was also very involved with the AIDS Council in my city. And I saw the discrimination. I saw the impact and effects of prohibitive laws or discriminatory laws, and I saw the stigma involved in that. I then worked as a sex worker. I ran an industry association that represented the adult industry in Australia, as well as a lot of the sex education programs and condom manufacturers, etc. And I kept seeing that the community attitudes were going in one direction, but politicians' work was going in the other direction. So we were seeing a fundamental split, and whether that was around end-of-life choices, around drug law reform, around marriage equality. There was a whole range of areas where the government was completely out of step with the community. And I worked from the outside, walking the corridors of the various state and federal parliaments around Australia, trying to change this. And in the end, we thought, not so much if you can't beat them, join them, but let's take these issues to the ballot box. And so the Sex Party was born at that stage, Brent.
And you actually got elected under that party.
That's right, much to everyone's surprise. So this gave me the opportunity to talk about the issues that I thought were important. So I got assisted dying I got an inquiry into assisted dying that eventually led to legislation. I introduced legislation to provide safe access zones around abortion clinics. So people started to sort of, take notice of the Sex Party and were somewhat surprised at the level of activity and success we were having. So at a polling booth for a federal election, every second person would go, "Love what you do, change your name. Love what you do, change your name." It takes a certain person to wear a bright yellow t-shirt with sex emblazoned on the front. We went back to the drawing board and thought about who we were and who we wanted to be and who we wanted to talk to in our community. And we changed our name to Reason. And as we like to say, we've become a voice of reason.
Fiona, when you first got started, and I'm sure you're still fighting on many of these issues now, did you understand even then, back then, that it was harm reduction that you were fighting for?
Back in the 1980s, when I first kind of got involved in this area, I don't think we had fully articulated the theory of harm reduction. I didn't know that's what it was, but certainly as I started to get involved in the sex worker community, we started to use that terminology. And I now realise that, yes, it was always about harm reduction. And I think that might be safe injecting rooms. It might be, as I said, clean needles. It might be drug education, but it also might be things like, drink driving or, blood alcohol testing on roadsides. We're not going to stop people from drinking, but what we want them to do is not harm anyone as a result to that. So, harm reduction permeates throughout our lives, yet you and I might have a strong understanding about it. We might talk about it all the time. I still think that the general population is not all that familiar with that term. And that might be something that we need to continue to work on.
So you're certainly fighting the big fights against some of the big issues. So let's turn to tobacco harm reduction now. In your mind, is THR a valid application of the harm reduction philosophy as you would find it with, say, hard drugs?
Of course. And it's completely natural. And it's a completely natural progression. It's a completely natural response to tobacco. You know, I look at the people who are rallying against tobacco harm reduction, and they were some of the pioneers of harm reduction in this country. They were also some of the people who rallied against tobacco, who tried to, reduce tobacco use in this country and in your country as well. And yet they're now sitting on the other side of the fence saying, no, abstinence is the only answer. Or you go to Big Pharma and take on board some sort of Johnson & Johnson nicotine replacement treatment. So there's, it really is quite perplexing. And then the outcome of that is that governments don't want to touch it because they're too scared of the Heart Foundation, the Cancer Council, who are all not providing any great rationale except for, we don't know how dangerous vaping might be. Well, what we do know is how dangerous smoking is. And what we do know, and none of them will disagree with this, is that vaping is not as dangerous as smoking. So, this is fundamental harm reduction. And we've got, these people who previously argued for harm reduction, previously fought for needle exchanges, previously fought for opioid replacement treatments, and yet they won't support this replacement treatment. And I don't understand it. And, I'm not a conspiracy theorist, but sometimes you kind of think, are they in the pocket of big tobacco? They get great big donations from huge supermarkets, which are the biggest retailers of tobacco. So is that the rationale? Now, I don't actually think it is, but it is strange. It is strange and it is perplexing.
And that's where my question comes from, because there are so many people that, were warriors for harm reduction when it comes to hard drugs and so forth, but yet they're the most challenged to accept it for tobacco. And so wondering whether or not if they just don't think that it's a valid application of the theory. And I'm trying to be kind by coming up with that kind of analysis.
I agree with you. I think there's also this growing stigma around smokers that somehow smokers should know better. That smokers are not born into this addiction through trauma or mental health. Actually, they are, but that through trauma or there's not this very sad backstory that we might see in other areas where drugs are problematic in someone's life. So is it that, or is it just that they have always run these quit campaigns, and they don't want to let go of that and run these campaigns that nicotine is the problem, that nicotine is bad, and that is that's misinformation because I'm sure putting any impure substance into your body is not ideal, but we know it's the smoking, we know it's the tar that is actually killing people. So there's concern about young people, and I share that. I share that concern. But what we're doing now is actually putting young people at greater risk than if we were to take a different path of regulation.
We're based in Canada, and so we're both come from the Commonwealth countries. And if anybody should have some common sense, it's us. We don't seem to, though, be listening to, the motherland. England's doing one thing. They seem to be the only bright light when it comes to this issue. What's going wrong with everybody else?
I liken Canada to New Zealand. Canada's just that bit better than their adjoining cousin, United States, and New Zealand is just that bit better than their brother being Australia. And you see what New Zealand has done, and you see the success of what they've done, and they will be smoke free, probably before the end of this decade, which is quite extraordinary. Now, Australia, we have been stubbornly sitting at the same level of smoking rates for close on a decade. And then if you look at our Indigenous communities, if you look at our Aboriginal brothers and sisters, their smoking rates are far higher. And we are doing nothing about that. We are letting those people die. Why are we not providing these tools to our Aboriginal community? And in fact, when I speak to Aboriginal organisations about this, they say, Fiona, when we mention this at the table, we get shot down. And we know that our community members are wanting to use vaporizers, and we want to be able to give them information about how to do it safely, about what's the best device for them and what should be their expectations. And they get shot down by Cancer Council, they get shot down by health departments. And again, if I was going to be a real conspiracy theorist, I think of all of the tobacco tax that we make from those really hardened smokers at the top, few percentages of smoking rates. We make billions of dollars in Australia on tobacco tax. I think it's somewhere around $3 or $4 billion a year. It funds a lot of hospitals. So is that also coming into play in these policy decisions?
Now, Australia just recently, I guess within the last 2 years, started moving towards a much more stringent access to nicotine vapes. And it being now, you have to actually get a doctor's prescription. How is that going?
It's going terribly, Brent. Although, it is going terribly, but there also is probably, it has created some greater understanding about harm reduction and alternative and nicotine replacement therapies amongst some of the medical profession. However, it's nowhere. And unsurprisingly, we all knew this was going to happen. It's creating a giant black market in the product, a completely unregulated market, and it's causing far more harm. It's probably preventing people from accessing this replacement therapy. So for many people, it's become just too hard. Their GP's not interested in prescribing a nicotine product for them or via a vape. So they're going back to smoking. We've seen, there's always these kind of sweet spots in harm reduction, and we see it in tobacco. You keep up putting the price up, and people stop, go, right, that's it, I'm quitting. But then it gets to a point where there's a certain percentage who can't quit, and that's where organised crime and criminal organisations get involved, because then they see that market. And we've seen that in tobacco, and sadly, we are starting to see this in vaping, even though, and despite all of this, and I think this is really, this makes this point, vaping numbers in Australia are continuing to rise. They're still fairly small, but they're continuing to rise despite all attempts to stop people from accessing nicotine replacement vaping.
Are you worried that enforcement will lead to actual incarceration at some point?
Oh, it definitely will. It definitely will. Although, I've got to say that we know we have a huge illicit tobacco market in Australia, absolutely massive. And very little is done about it. Very little is done about it. There's occasional big busts, and, the TV cameras come and the police show the big, bundles of tobacco or illicit cigarette packets and things like that. But it doesn't even touch the tip of that iceberg. So I suspect that, yes, we could see people being incarcerated. Right now, it's actually illegal to possess tobacco to possess nicotine without a prescription. So it's actually a criminal offence now for someone. Now, I'm not aware of anyone who's been charged from that, and I'd challenge the police to figure out whether that person vaping in the street is vaping a nicotine product or a non-nicotine product. And I think the police quite rightly felt that they've got better things to do. But, right now, using nicotine without a prescription could put you in jail, which even as I say that, I can't believe those words are coming out of my mouth.
So this truly is a new war on nicotine, replacing, I guess the drug war is still ongoing in Australia, but, it's now a new war.
We are much happier providing, Suboxone or methadone or, any form of opioid replacement therapy. The community is even more relaxed about, that than they are around providing a replacement therapy for smokers. And this goes to this kind of notion that you should be able to just give up. And, and look, for most lovely middle-class people who've gone to good schools and all of that, they have very low smoking rates in those cohorts. The smoking rates are much higher in our communities of disadvantage. And the cost is so high. We're seeing, in some places, people having to forego, buying good healthy groceries to support their nicotine habit, because the only way they can access it is through very, very expensive tobacco.
Yeah, when you keep piling on the nicotine tax, the tobacco tax on the cigarettes, and it does hit that point. In Canada, at one point, right before I quit smoking, several years ago, because I was a 2-pack-a-day smoker, it was $32 a day. I mean, that's a serious habit. That's a drug habit. And so at what point does that become really being taken advantage of?
Exactly. And I wasn't a 2-pack-a-day smoker, but I really struggled to give up, and vaping provided that solution for me as well. So, I can advocate from that personal story, and understanding, how much better I feel not smoking. But even from a government perspective, smoking, while we make a lot of money from the tax, smoking is really expensive. It is expensive to our health system. The cost to our health, the cost to early death, the cost to emphysema and other forms of lung damage, the cost of heart disease, all of those things should make every fiscal conservative politician race to the statute book to change that law and to make it easy for people to be able to vape. And and sadly we're not getting that. I haven't given up, because what I'm seeing is people are doing it anyway. Australians and people around the world are understanding that this is a healthier option for them, that this reduces the harm of tobacco, and this helps them give up, and it helps them become smoke-free. So I remain optimistic that as our numbers of vapers continue to grow, that politicians will actually start seeing it as an electoral matter, and that they will see that voting against a large cohort of their electorate actually could be electoral suicide for them.
What is the argument then that access to safer nicotine products is a human right?
We should have that autonomy of our own bodies. So if something is available that reduces harm, that enables us to live a healthier life, then that is a human right.
Fiona, the Global Forum on Nicotine Conference in Warsaw, Poland is coming up this June 16 to 18. You're attending again this year, participating on several panels. One of those panels is Safer Nicotine, Human Rights and Legal Challenges. Fiona, why is a conference like GFN 22 important to tobacco harm reduction?
It is absolutely crucial that we keep the common sense, we keep the evidence in the public eye. And that's what conferences like this do. They provide us with platforms to talk about the actual evidence around tobacco harm reduction and around nicotine replacement therapies. I think also it's about people who vape themselves, being able to see that they're not alone and that there is a community out there and that what they're doing is not unscrupulous, is that it actually is about their own health, and it reaffirms the decisions that they made to give up smoking and use the tool of vaping or any other nicotine replacement therapies. That was a decision that many other people have made.